Welcome, everyone. This presentation is called Making Time for Me, which means making time for you. Please note that this presentation is intended for general education purposes. It is not intended to provide medical advice to any individual. What does it mean to make time for me? Making time for ourselves means giving ourselves the space, time, and intention to monitor our health and respond to symptoms, practice healthy thinking, enlist social support when needed, participate in meaningful and pleasurable activities, practice self-compassion, and communicate our needs. We will talk about these in a bit more detail, starting with monitoring health and responding to symptoms. Are you ambivalent about taking care of your health? We often find that the idea of taking care of our health is met with challenges, including thoughts like, I don't want to go to the emergency room for nothing. I don't want to worry or inconvenience anyone. There's already so much on my plate as it is, and I don't have room to add anything else. It's not fun to be a patient. I don't want anyone to need to take care of me. I'm scared. If you find yourself having one of these thoughts, you're not alone. At the same time, taking care of our health is important. Take a moment now and think about what might be some of the possible consequences of not taking care of your health. Some possible consequences include worsening of cardiac symptoms, such as chest pain or shortness of breath, higher risk of hospitalization, medical complications, and serious conditions, increased feelings of anxiety, helplessness, or frustration, loss of mobility or strength, which could eventually lead to reduced independence, strain on family and loved ones, and less capacity to enjoy things that you enjoy, such as hobbies, travel, or spending time with loved ones. At the same time, there are benefits of taking care of our health, including improved physical functioning, which may include having more energy for daily life and reduced burden of cardiac symptoms, better emotional well-being, increased quality of life and more time for loved ones and hobbies, and perhaps a sense of achievement for taking care of yourself. Regularly monitoring and responding timely to symptoms can help you take care of your health. Some examples of this include getting regular checkups, knowing your own health baseline, tracking symptoms and acting, whether that be letting a doctor know or going to the emergency room, when you experience variations from your own baseline, following medical advice and taking medications, and seeking help when you need it. As a suggestion, when you find yourself experiencing ambivalence or barriers related to taking care of your health, remind yourself of the reasons why you want and need to take care of your health. Communicate those reasons and those needs to others. Another example of taking time for me can include practicing self-compassion. We all have feelings, such as sadness, anger, guilt, or fear. They're a normal part of being human. Blocking or inhibiting emotions can sometimes be helpful, but blocking or inhibiting emotions all the time can also present challenges as they may simmer under the surface or lead to suppressing behaviors such as drinking excessive alcohol, eating in a way we can't control, acting like nothing is wrong, or getting really angry at others or ourselves, withdrawing from people and things we care about, blocking out thoughts or memories, or mentally checking out or going numb. If you find yourself doing any of these routinely, it may be helpful to give yourself some time and space to let yourself feel the emotion in a self-compassionate way. For example, you might let yourself feel sad for a moment reminding yourself that the sadness is valid, it's a normal part of life, and it will not last forever. At the same time, sometimes emotions are very strong. Having a safe place to process these emotions is important. If you are having a hard time processing emotions, please seek professional help. Here at Cardiac Rehab, we have a behavioral medicine group who is a part of the team and available to meet with you. You can also ask your primary care provider for a referral, or if it's an emergency, you can present to your nearest emergency room or call 911. Self-compassion is the practice of being kind and compassionate with ourselves. As briefly mentioned before, practicing self-compassion when we experience difficult emotions or stress can be helpful. There are 3 key pieces to this practice. 1. Noticing your feelings or your own suffering. 2. Reminding yourself that imperfection, feelings, and failure are a part of being human. And 3. Respond to yourself with kindness and understanding. It often comes the most naturally for us to provide compassion to our close friends. Take a moment and think about what you would do or say to a close friend, family member, or loved one if they were to come and tell you about a struggle they were experiencing or a time they felt down. What would you say to them? What tone would you use when you spoke to them? Now, think about times when you have felt bad about yourself or when you yourself were struggling. How do you typically respond to yourself in these situations? Is there a difference? If so, why do you think that is? We often find it easier to give compassion to others over ourselves. How might things be different, however, if you were responding to yourself in the same way you typically respond to a close friend when they're suffering? Why not try treating yourself like a close friend and see what happens? Another self-compassion exercise you might try is giving yourself supportive touch. We know that supportive physical touch can help us manage stress. The next time you notice yourself feeling stress, perhaps try taking 2 or 3 deep breaths, gently placing your hand over your heart or your cheek, face, or arms, depending on what feels the most comfortable. Feeling the gentle pressure and warmth of your touch on your body. If you wish, you can make small circles with your hands or feel the natural movement of your body as you breathe. And give yourself a squeeze. And you can linger with this feeling as long as you'd like. The last aspect of making time for me that we'll touch on today is enlisting social support and communicating your needs when you need help. In order to help make time for you to monitor your health and take some time for self-compassion, it might be necessary to ask for help from others from time to time. Asking for help can be challenging. We are often used to different roles, such as being in charge, managing the home, helping others, and being caretakers. And changes in our roles are often stressful and different. When do we need help? We might find that we need to ask for help when we're not getting what we need, when we're not able to take care of ourselves, when we're healing and must focus on rest, or when others are not taking on a helping role without us prompting them to do so. How then do we ask for help? It can often be hard to discuss with others what we need, and it can be even more difficult to do so when we're undergoing a role change, which can sometimes lead us to feel embarrassed, angry, or upset. I want to introduce you to a strategy called Dear Man. Dear Man is an acronym, kind of like a cheat sheet for asking what you need. There are two parts to Dear Man. The DEAR helps guide you on what do you say, and the MAN helps guide you for how do you say it. We will go through this acronym now with an example, which is returning to work after recovery from a cardiac event. The D in Dear Man stands for describe the situation. Here, you want to communicate what is the background to your request. You want to communicate this background using only facts, as it makes it easier for others to hear. For example, someone might say, I've been in recovery and on medical leave for 6 weeks, and I am about to return to work. My doctor has provided me with recommendations about what I am and am not able to do, and this includes recommendations for lengths of breaks. However, I am feeling fatigued during the day with my current accommodations. The E stands for express your perspective. This is when you include your thoughts and feelings about the issue, and you can choose how important it is to share this information with others. For example, you might follow the description with, I really appreciate your willingness to accommodate my medical needs, and it feels great to have such supportive colleagues. The A in Dear Man stands for ask for what you need. Here is where you make your request. You've already justified your request by describing the situation and expressing your perspective, and it's here where you can be specific about what you need. For example, I need to take 15-minute breaks every hour. Finally, R stands for reinforce. Why is this good for you, and why is it good for the other person? For example, this will help me stay healthy and be a more productive worker. I really appreciate the accommodation and support from you all. The same way the first half of Dear Man tells you what to say, the second half, MAN, tells you how do I say it. You want to communicate your needs mindfully, assertively, and willing to negotiate. With regards to mindfully, do what you need to do to feel cool, calm, and collected before you talk to the other person. It might help to practice relaxation and self-care strategies beforehand, like deep breathing or self-compassion. You want to ask for what you need assertively. Now, assertive is different from aggressive. You want to limit your hostility. But also be careful not to be passive. Don't shy away from discussion. It can be helpful to maintain eye contact, good posture, speak in a clear voice, and be willing to problem solve when you get a response. Sometimes the answer is no at first. That doesn't mean that your needs are not important or that they don't need to be addressed. And through negotiation, you can consider how we can make it work. Here we see the full example provided in our Dear Man exercise. I have been in recovery and on medical leave for 6 weeks, and I am about to return to work. My doctor has provided me with recommendations about what I am and am not able to do. This includes recommendations for lengths of breaks. However, I am feeling fatigued during the day with my current accommodations. I really appreciate your willingness to accommodate my medical needs, and it feels great to have such supportive colleagues. I need to take 15-minute breaks every hour, which is an increase from a 15-minute break every other hour. This will help me stay healthy and be a more productive worker. I really appreciate the accommodation and support from you all. In this video, we've touched on several different aspects of making time for me. And underneath them all, it can be helpful when life gets busy or overwhelming to think about, what do I value? What do I need to get done in a day? What do I need to do to be happy, healthy? And how can I fit these things in, knowing that there's a limited time and limited energy that I have in every day? In service of that, how might I schedule or plan out the day? How can I remind myself of my health goals and values? And how can I communicate my needs to others? Thank you all for your attention to this video, and please reach out to a team member if we can be of any more assistance or if you have any questions.